7, 5. We are live.
Can you hear me?
We are live also. So
okay, so good evening, everybody. Welcome to today's webinar brought to you by the Orthopaedic Research and Education Foundation India, being broadcast through OrthoTV as well. And today we have the pleasure of having Professor Ananda Kisor Pal again with us, and he's going to do the second half of his earlier talk on recent advances. So I think all of you who attended it would know how useful they found it, found the first half of it. So I would request Professor Pal to go ahead and give his deliberations for today, and then we can have questions at the end of it. Over to you, Dr. Pal. Well, you're mute, Ananda.
Okay. So good evening, everybody. Thank you, Dr. John Mukhopadhaya, for his excellent endeavor, continued endeavor for the next generation for building the knowledge and practice for next generation, not only for passing the examination, but also to how to write, how to make the knowledge for being preparation for the next any orthopedic session. So without wasting time, I just want to start my topic, that is the recent advances in orthopedics, which has become the fourth paper in all the theory examination. And previous classes, I have covered some topics, and now I see the orthopedic recent advances in orthopedics, a vast subject. So it is very difficult to cover within half an hour or 1 hour. So in this for this coming 30 minutes, I shall try to cover some important topics which will come in your examination, and I can give some list and how to write the exact topic in when it comes in the examination, and I will show some specimen writing which is exact which is written by some students in the examination. So in the previous class, I have shown some topics. So just one to cover from the previous class, that is a regeneration of the lost tissue in the orthopedics. Basically, you can see there's once it has come. So we have to, I've already told, so in any recent advance, we have to write it down first in the background. Why? What is the data needs? Why it is required? So what is the existing knowledge? So you start from this. So what is the data needs? What is the existing knowledge? What is the knowledge gap? And what is the necessity to have these recent advances? What is the disadvantage of the previous or conventional technique? So we'll start with this. So that is the conventional one. Now from the recent advances, we will start actual start. So what are the indications? So this is the indication for regeneration, like where the fracture healing is necessity in a non-immune and delayed immune, cartilage repair, because articular cartilage, the most valuable substances, once it is lost, it should permanently lost. So especially in osteoarthritis and rheumatoid arthritis, tendon and the skeletal muscles repair, especially in the sports injury. That is where the several eminent sports personalities, they have used this technique. And there are spinal cord regeneration to some extent, it is made valuable. So what are the tools? Basically, the initial prototype is a bone marrow aspirate concentrate. And now the coming, it's a PRP. It is already in practice. And what is the future? That is the platelet-rich fibrin. So what is that? I'm coming one by one. So basically, bone marrow is aspirate concentrate. What is constituted of? It is constituted of the hematopoietic stem cells and the mesenchymal stem cells. Basically, the mesenchymal stem cells, it is diluted with these hematopoietic stem cells, and because of that, there are several inflammatory procedures going on. That is why it is not becoming a popular one. Now, the PRP has come, which is a very popular one nowadays, because it produces various platelet-derived growth factor, and this platelet-derived growth factor that stimulates the progenitor cells, which is already in the system, which can differentiate into different categories for depending on the situation. That can produce osteoblast, that can produce a chondroblast, that can produce the fibroblast, like this, depending on the situation. So in the previous class, I just discussed about the basic mechanism of this tissue engineering, which is related with this. That is, we have to introduce the cells, basically the mesenchymal stem cells. So for the bone and osteoarticular diseases, it requires some scaffolds because for holding out, for giving the support for resting on the in that hard areas of the bone, as also for the stimulation it requires some signaling molecules which is osteoinductive. So all the three substances that is required for the osteoarticular diseases, and in time that can change the environment for regeneration of the bone. And there are several concentrated like that. That is platelet-rich plasma. That is platelet-rich the plasma-rich growth factor. That is that is leukocyte platelet-rich fibrin, which is second generation. As also the advanced platelet-rich fibrin. There are several pros and cons. So anybody can go through this and so write this. Now we have how to write. There is a preparation. How to it is prepared. There is platelet-rich plasma and a platelet-rich fibrin. Platelet-rich plasma, once so see, this is platelet-rich plasma is done by there are two modes of this centrifugation. First is the light spin. So whole blood which is taken is autologous whole blood along with the anticoagulant. When it is first centrifugation is done by light spin, it is divided into three components. Initial upper part is the platelet in the WBC, inner part is the buffy coat, which is consisting of the completely WBC, and also the lower part is the RBC. So if the upper two part is taken away, and it is centrifuged with the medium spin or the high spin or the hard spin, that can be divided into two components. First is the PP, that is the poor platelet-rich plasma, the poor platelet plasma, and also there is a platelet-rich plasma in the lower part. And this lower part is mainly useful because it has several growth factors which can stimulate the stem cells, which is also in the system. And now so this is platelet-rich plasma basically is a liquid, as it is anticoagulation added, so it is a liquid, and basically it is used for the soft tissues. Whereas when the human blood is collected without anticoagulant and it is specifically centrifuged with a specific rotation, that will lead to a jelly-like structure like this. It is like a jelly-like structure. It is a little bit coagulated and will make a jelly-like structure. And this is it consisting of there is a platelet-poor plasma and the platelet-rich fibrin. So this is it will look like this. So if we remove this upper part, and take this middle part, so this middle part is basically platelet-rich fibrin, which is like a jelly-like structure. So it already contains the fibrin. So it contains the scaffold along with the growth factor. So it is a complete one. So this is the most important feature of this and used for the bone. There are several causes, indications I have shown it. Now there are different types of platelet-rich fibrin, which is a second generation category, and there are these like these are all the different types like the advanced platelet-rich fibrin, advanced platelet-rich fibrin plus, and what is most important is the injectable platelet-rich fibrin. Basically, it is produced by there are several types of centrifugation, like 700 RPM for 33 minutes in plastic tubes that can be produce this sort of fibrin. And again, when there is a structural integrity is required, so this platelet-rich fibrin is produced in the titanium shell, and then the specific type of rotation is required for production of this, and the whole system can be introduced into the human body for constitution of the structure. So these are the types, and there are several indications like lateral epicondylitis, delayed union, the long bone fracture, and the knee osteoarthrosis that can be used. So these are the usual indications and the references. So this is actually this remaining, so that I completed. Now I'm going to exactly the part 2. All are completed now. Now I'm coming to the part 2. Yes, part 2. So basically there is some extended list like the growth modulation. So these are usually asked in your HIPA, as also it will come in the 4th theory paper. Factors for stimulation of the growth healing, biomechanical principles of TKR, modern gap balancing in the TKR, destruction histogenesis and its recent advances, bone banking, limb sparing surgeries, meta-analysis. Like there's any one topic from the research article which is much more relevant and very useful that can be asked in these recent advances. And like some investigative measures like use of piezoelectric current in orthopedics that can be used. Now, suppose it is robotics in orthopedics. Why it is important? What is the background of the study? Because this is the background. So knee arthroplasty several challenges like it requires high patient satisfaction, low survivorship, and low adoption. So, and there are factors of success that maybe like it requires some improved component design, optimal pain control and the rehabilitation, accuracy of the implantation, and soft tissue balancing. So, why robotics? Why robotics is required? Why robotics is required? Because it makes the surgeons good regarding the accuracy in implantation, eliminate the outliers, mitigate the inexperience with instruments and the implants. Why and also they make the good surgeons better in the form of the patient specific planning, eliminate the outliers even more, perform more difficult procedures, and expand the indications. So what are the differences between? So these are the usually I'm showing mainly the points because it is very difficult to cover all the objects. So in this manner, so what are the basic difference between from this conventional traditional method knee surgery and the robotics assisted knee surgery? Because there's only the one the company it is popularized. It's a Smith and Nephew company, and I'm taking this all these informations from this Smith and Nephew company, because these are the several advantages. Like the conventionally said, like the high blood loss is the minimum blood loss, the larger incision is required, smaller incision, like several advantages there. Now, how it is differs from standard navigation robotics is how it is differ. See, there are several steps like refine the femoral bone cut, refine the tibial bone cut is done manually, whereas all the bone cuts are done robotically and is in accurate manner. So this is where there are several advantages over this. Now, what are the advantages in this? It is surgeon controlled, it is image-free patient specific planning, and several advantages as we have to mention writing. Now, how it helps? It helps in threefold. It helps in the patients in quicker recovery, in surgeons in consistent accuracy results, and hospitals like it's a market differentiation, as also as a potential shift to the payer needs, and very quick turnover. This is also important for their hospital point of view. So there are several advantages. Now, three basic steps like registration, planning to determine the optimal implant position, execution of the precise bone preparation with handle bar. Now, what are the indications? The unicondylar knee replacement, patellofemoral knee replacements, and the total knee replacements that can be used. So it is, I'm not going into detail. So these are the steps by which you have to write in the robotics. Now, gene therapy, in the previous class, I have discussed some amount of gene therapy. So I'm skipping this one. Basically, the different, so these are I'm giving the points. What is the definition? Gene therapy basically is the introduction of the genes into the existing cells. So it is a one step ahead over the tissue engineering. That means once we are giving the mesenchymal stem cells, that mesenchymal stem cells may become damaged inside the system. So if we infect these mesenchymal stem cells with some specific genes by the virus, which is carrying the genes, so the viral infection, virally infected mesenchymal stem cells, if we inject this, that can do the specific functions and they can survive in the system. So there are several steps. I'm not going to detail. There are several classification like this is the vector delivery method, promoter method. So these are the different types and classification. So it is a simple. So it is a very simple. If we write in a paragraph, it is very difficult to cover up. So it is very, so in this manner, if we write this, it is very easy to check and easy to see, and is for the examiners. It is also gives a good impression for them. Now, there are several types of gene therapy, like somatic gene therapy, germline gene therapy, systemic gene therapy. Now, basically, it is given by the gene is introduced by two systems, either by the viral vectors, is the specific virus, or by the non-viral vectors, where specifically the naked DNA or the DNA protein complex it is introduced, or the liposomes carrying the special DNA that can be introduced, or gene gun that can be introduced. So all in the experimental stage. So that is, I'm not going to detail. Now, local gene therapy basically is the direct or the indirect. Direct is basically where the cell is directly inoculated inside the damaged organs. Indirect is the target cell is removed from the body, and so the damaged cell is removed from the body, and it is exposed to the vector in the vitro, and it is reinserted. So that is now what is the scope in the orthopedics? Now I'm not going to detail, like it is used in the rheumatoid arthritis, osteochondral defect in the articular injury. There are intervertebral disc, that's where the direct delivery that is tissue growth factor beta to nucleus pulposus, which increases the proteoglycan synthesis and that reduces the degeneration. Now, skeletal muscle injury that can be used, even in the spinal fusion that can be used. Now, in the bone healing, it is also used for direct, that is using the adenovirus with the bone, that is bone morphogenic protein gene and the immune response to the virus, and indirect with osteogenesis, osteogenic precursors and the stem cells. So there are, see that if you make this as a simple chart, so it is very easy to see so without any direct sentences, it is easy to reproduce this. So orthopedic gene therapy, Mendelian disease, non-Mendelian diseases, maybe chronic disease, cancer, and the tissue repair. So in this manner, one student can easily earn the higher marks. Now, the recent advanced metals, what is the need? So need is basically we are moving from rigid fixation to the elastic fixation. Now, in elasticity, if the elasticity one step ahead, if elasticity is less, that leads to the stress shielding. So we require elasticity. But if the elasticity is more, so that also reduces the bone formation inside it, and that can cause deformity. So we have to it requires some research advance. I'll show you. Now the initial the non-locking plate, it based on the principle of friction, whereas the locking plate it basically based on the angular stability. And now the era has come where the anatomical metal is required for exact distribution of the loads across the fracture site. Now the surface character, it requires some recent improvement so that there is a less chance of bones metal becomes less immunogenic, and that bones can be used as a bone substitute as there is a lack of bone, like in several bone losses in revision surgery in replacement arthroplasty. Again, there are some ways where the bioabsorbability is required in some situation. Now, what the metals which almost similar to bone, these are the porous tantalum, the shape memory alloys. I remember one in my previous class, one student have asked about the shape memory alloys. Now I'm going to describe this. And another is the degradable metals. Now, what is shape memory alloys? Basically, the alloy which basically changes the shape depending on the pressure or the temperature. This is basically this shape memory alloy. Basically, there are two crystal structures are used in this. There is austenite and the martensite. Austenite is the SMS structure with high temperature, while the martensite is a structure at the lower temperature. So these are the mixture of these two crystal structures, and they can easily deform inside the bone, and basically they change their load pattern inside the bone. So besides the shape memory effect, they have a corrosion resistance, wear resistance, super elasticity, and favorable histocompatibility. So basically, these are several advantages of this shape memory alloys. And you can see that this sort of shape memory alloys can be used for the olecranon fractures like this. These all are in experimental stage, and there are some. I have taken from another author, another worker. It is not my work actually. So and see this is used for fixation of the olecranon fracture. Now, as it is extremely tissue friendly, so it doesn't break actually, and that can produce because of micromotion that can produce the bone formation. Now, recent advances taken to increase the bonding of the metal with the bone. There are several techniques like thermal spraying, electron magnetron sputtering, and the laser cladding, which are proposed to successfully deposit the bioactive material on the metallic substance, which can increase the integration of the bone over the metal. Now, to eliminate the metal stress shielding, so there are several techniques that they are like selective laser sintering, selective laser melting, as well as electron beam melting. And some surface modification is done over the titanium implant using the silicon powder mixed electron spark alloying, and the hard layer of bioceramic oxides and carbides are formed, which increases the integration, osseointegration. That will make a bond, significant bond between the bones and the metals, and that can help in the load shearing effect. More biocompatible implants are is a tantalum. It's a wonderful metal which is coming in. It's a big way. Tantalum has the characteristics of hardness, toughness, chemical resistance, and good compatibility with the human bones. And the porous titanium is basically known as the trabecular metal, I've already discussed where there is a requirement of the bone, but the required bone is of the body, either from the allogenic or the autogenic, is not sufficient enough to provide this structural support. So in those cases, like like revision scenario, revision total knee replacement, or a revision total hip replacement, where a large amount of bone is lost from the body, this porous tantalum, that is also known as the trabecular metal, that can be used for bone replacement. Now, the degradable metals, these are also coming in a big way, used to repair the bone defects, particularly in the bone scaffold, which can completely regenerate the bone, like the magnesium metal. I'm not going to detail, iron alloys, zinc. These are the used for the better osseointegration. Now, this is another important mechanism. This is the angular stable locking system with polymeric slip inside the interlocking system of the nail, interlocking nail. So this is the system which there's a slip, polymer slip, and because as it is inside the nail over the screw, so that will prevent the loosening, and that can the playing of the screws inside the nail, and that will increase the stability of the system. Now, another important is the fractured plates. This is a secondary fracture. It is a contouring 3-dimension. So it is a 3-dimensional contouring of the plate can be possible, keeping the locking holes almost intact. So this is another improvisation of the locking plate. Now this is the advanced locking plate system. So this is another improvisation. So that can be used for compression, as also changing the structure depending on the fracture pattern, without deforming the configuration of the locking system. Low profile anatomical locking plate, as you can see here, that can be used for the proximal humeral fracture, and also there are plates are coming for the patellar fracture, as also some specific plate for the acetabular fracture. Now, tribology is frequently asked in this category. What is tribology? Basically, it's a branch of science which deals with the study of lubrication, friction, as also the wear. So, what is the need? Tribology is the fundamental for the function and long-term survival of the orthopedic implants. So, in vivo testing is that not going to detail. Basically, the cemented metal on poly, it is a primary tribology used in our total. There is a replacement system, and basically it leads to abrasive adhesive wear. It is a cement disease. Now there are improved tribology has come. That is metal on poly. There is a polyethylene debris. Basically, it now comes to the particle disease. Now the question has come: how to reduce this particle disease? Because particle disease that can cause this imbalance between the osteoblast and osteoclast, leads to osteolysis, which leads to ultimately the aseptic loosening. So these are the tribologies. The primary tribology is a polyethylene and a metal on metal. This is a part that leads to particle disease in the metallosis. Standard polyethylene is still considered the good options, but it requires several release of the particles. That is how the metal on metal has come. But still, the metal on metal that produces severe metal debris. And for the active patients, might be the resurfacing arthroplasty is used for the metal on metal debris, because it presents a good long-term clinical results, but ultimately that produces severe pseudotumor-like syndrome. Now, ceramic, there are the first generation is based on the zirconia, second generation is the aluminum. Basically, it is used because of its excellent wear characteristics. But similarly, that causes some problem like the squeaking sound, and that because of the squeaking sound, that it requires some revision. Sometimes at least 4 to 10% cases, it requires some revision because of this is very unpleasant for the patient. But it is an excellent instrument, excellent tribological, but ceramic is particularly suitable for patients having the large femoral head. It requires an increased jump distance, so reduce the dislocation. And ceramic on metal is the fracture is for the ceramic femoral head component, and elevated wear as seen in vivo, which has any clinical advantage of the metal. Now it is asked, what is the there is a highly cross-linked polyethylene, and what is these advantages over it? So highly cross-linked polyethylene is either a metal on a ceramic head, offers a highly promising bearing solution that displays the low wear while being the more forgiving for the cup positioning than alternative bearing. It's a low revision rate. It minimizes the risk of the revision after the 10 years or more. But there is a problem is there is a risk of oxidation. That is how it is included with the vitamin E. With the vitamin E is added for reduction of oxidation. So, and this is now is very popular. Now, see this question is asked: how the this highly cross-linked polyethylene is used? So, see, this is the model question paper. So, this is he has written the definition. See, it is a definition. What is the advantage? The fatigue resistance, reduced wear hotels. So, see how it is produced. So, these are the two ways. There is this is gamma irradiation in the vacuum and the ram bar extrusion. So, these are two ways it is. So, see, and the candidate using the two color. And so this color is extremely catchy, and they have given enough empty spaces so that the examiner can easily look out, easily can read out, and so the impression is very high. So what are the properties? See, this area is remain blank, and this is only written on this area. There are several these empty spaces. Now you make a fragmentation of the topic. So this property, the role in orthopedics. This next is the type of the wear particles, that leads to how it produces some aseptic loosening. So this is the way to write in this. Now the advanced investigations, like in the advanced investigation in tuberculosis. So these are the routine investigation in tuberculosis: low hemoglobin, the raised DSR, everything. So you have to start with this background, how to detect the bacteria. Now how to send the samples, you have to write it. This sample should be sent. Histopathological sample should be embedded in the normal saline, not in the formalin, like this. Now, culture is the genotype diagnosis is the Lowenstein-Jensen medium or the Bactec mycobacterium growth indicator activity is coming in a big way. It's a liquid medium because it is highly advantageous, but because it requires only the 2 to 3 weeks time for this culture. The Lowenstein-Jensen media, it requires some 6 to 8 weeks. So now this advanced investigation for detection of the drug resistance. So there's a CBNAT. There's a mycobacterium growth inhibitor tube, phenotypic drug sensitivity test, Lowenstein-Jensen medium culture, and line probe assay. So these are the used. Now, so these are the this another is it is a drug sensitivity test. I'm going to detail. Genotypic diagnosis, the gene expert, and there is another there is recent advances, the gene expert mycobacterium tuberculosis, rifampicin ultra, and the line probe assay. Gene expert is basically a novel test which not only detects the bacteria, but also it detects that the resistance to rifampicin. This is only one drug resistance, but it requires multiple drug resistance. It requires some improved gene expert, like gene expert mycobacterium tuberculosis or gene expert ultra or line probe assay. Now another important technique is the pyrosequencing, which can detect the multiple drug resistance of tuberculosis. Now, there are several other smears and stain of the tuberculosis, like apart from the Gilness stain, it is a Magrand-Jimsa or the Romansky dyes. So that can be used for diagnosis. Another is the Oramin Rhodamin or Oramin O-red fluorescent dye, which can rapidly diagnose the tuberculosis. Now, histopathology, it is the gold standard, is asked what are the types of the tubercles, not going to detail, and what is the role of these important investigations. So this is the roles, everything. Now the rule of what is the importance, because in the National Tuberculosis Elimination Program, which is going on up to 2022, 2027 to 2025. So what they are telling, we have to use everything, every investigations to isolate the tuberculosis or to diagnose the tuberculosis in a direct way. Otherwise, we can start the empirical treatment only after completion of this. So this is the so these are the line probe assay. Then there are several stages. I'm not going to detail. Now this is another question: the factors for enhancement of the bone healing, the role of the PMP. How he is writing. So enhancement of the bone healing, it can be done is a mechanical enhancement and a biological enhancement. Mechanical enhancement can be done with the help of the piezoelectric current. See, this extracorporeal shockwave therapy. So this has make it in this divided manner. So it is extremely catchy. He's using this two color and these two ways. So how they divide it in a differential manner. And see, this is the first page. This is the second page. This is continuation of this mechanical enhancement, like the distraction histogenesis. There is micromotion. There is irritability. There is biological irritation, and also the lupus. There is a low intensity pulse ultrasound, Whereas in the biological enhancement is the bone grafting, growth factor. There are several growth factors. There is a prostacyclin, bisphosphonate, scaffold, and increased protein like this. Role of BMP, how he has written role of BMP. First is the introduction. You have segmentation. So this is a mechanism of action. See, these are the different mechanism of action he has written. And see, these here make a chart. So very catchy chart is this, and then use in orthopedics. So this is the way you have to segment. You make a segmentation. You can make the different colors, and you can get the higher marks. See the meta-analysis. What is meta-analysis? Is the definition is a quantitative combination of integrating the findings. See how he has written the meta-analysis. See, this you have written the definition. See the meta-analysis, how it is done. It is very catchy, very small, the flow chart. What is the advantage? What is the advantage in orthopedics? And then there are different. You have given some example of this meta-analysis. And then there are several steps you can write. There's identify or formulate the problem. Next, carry out the literature review, extensive literature review with some keyword, specific keyword. Now decide the inclusion and or selection criteria, data extraction, and lastly, they carry out the basic meta-analysis with the help of some strategy, like Prisma model strategy. You can use that. So in nutshell, how to prepare the recent advances in the orthopedics. You have to make the list. There are several lists like this. To prepare, again, I'm repeating, we have to see the background, conventional treatment, the need, knowledge, and the knowledge deficit. We have to have some description. We have to give some diagram, flow chart. Next, the use in the orthopedics, limitation, whereas the advancement and the future. Thank you. Thank you, Janki.
Yeah,
Thank you so much.
Thank you. That was great. And I think that you should go on to questions.
Yes, sir. If DNV have any question, then you can ask directly. In between, sir, you have mentioned in the beginning about the PRP, that when it is used for soft tissue, it is called PRP. Otherwise, it is called platelet-rich fibrin if it is used in bone. So, sir, when PRP they used to ask in the exam, then they should write both and mention the name, or if they specifically ask about PRF, as you mentioned, sir, because I come to know it.
Or PRP, actually, I've already told how the PRP is taken. PRP is basically, it is taken, just one video is a little bit problem, doing some problem.
Okay, no problem, sir.
My video is kind of, I cannot start the video. There's some technical problem. Okay, so what is the problem is, so I've already told the PRP, so whole blood is collected. So there are two spin. First is the soft spin that differentiate into three zone. In the upper part is the platelet, lower part is the buffy coat, that is the WBC, and the lowest part is the RBC. If we take the upper two component in a separate test tube and make another spin, that is a hard spin or moderately hard spin, so basically that will lead to the production of the two part. In upper part is the platelet, that is pale platelet, less platelet-rich plasma, and the lower part is the platelet-rich plasma. So basically, it is a liquid because blood is collected with the help of the anticoagulant. So blood cannot coagulate this. Basically, this is the principle. So this is the liquid form. So if we liquid form is suppose it is used in the soft tissue problem, like the tennis elbow, like the frozen shoulder, like the plantar fasciitis. So these are the soft tissue problem in osteoarticular disease. We can use that because it doesn't require some scaffolding. It doesn't require some support to keep the cells in its place. So for soft tissue problem, that can be used this sort of PRP. But if it is inside the bone, suppose it is a non-union. So it is a non-union, or suppose it is a avascular necrosis of the femoral head. So if we use this, or suppose inside some delayed union. So if we inject this sort of liquid structure inside the bone, that can be easily diluted, that can go away from that targeted area. So it requires some scaffold. So that is why this platelet-rich fibrin is required, where the blood is collected and it is specifically centrifuged in a specific manner. So basically, I have shown it. So which is injectable platelet-rich fibrin that can be produced by speed of 700 rpm and for 3 minutes. So that can produce a gel-like structure as the blood is collected without anticoagulant. So blood is usually a little bit solidified, that make a gel-like structure, and once the gel-like structure forms, they can produce the 3 zones. So in the upper part, which requires that's poor platelet-rich plasma. The middle zone is the platelet-rich fibrin, and the lower zone is the little bit of the RBC. So in the middle zone, you have to take. So that is a very jelly-like structure that will remain inside. If we introduce inside the bone, that is the gap in the bone, or in the cavity inside the bone, that will remain inside. That will not liquefied and becomes removed from the system. So that is the principles of the platelet-rich fibrin, and that is the way we can produce some different categories of platelet-rich fibrin. Similarly, that can be produced in this titanium shell, which can be used as a scaffold for the production of the bone inside it. Okay. Suppose in severe bone loss, we can use that titanium shell, including this platelet-rich fibrin.
So,
Some questions in the chat.
yes, sir. Dr. Vinas has asked about hematoma arthroplasty.
Arthroplasty nahi hoga, arthropathy hoga.
Okay.
Avinash, what is it?
Avinash? Maybe. It's not. Okay, sir.
Arthropathy hoga.
Yeah, yes. Yes, Avinash?
Sir, I have heard hematoma arthroplasty for thumb.
Arthroplasty.
Hematoma arthroplasty.
Yes.
I don't know whether I actually.
Yeah.
It is very difficult to tell. Hematoma arthroplasty.
It may be a misprint. So if we can know about hematoma arthropathy, then
Arthropathy may be there. Arthropathy, yeah.
That is what you get in various bleeding disorders, where you get the joints swelling up and then changes, etc. So that is definitely there. But hematoma arthroplasty for the thumb, I assume you're sure about this, Avinash?
No, sir, I don't know.
Then why are you asking this question? Was it a DNB question ever?
No,
Huh?
no, never.
And there are things like conchal arthroplasty, where for the thumb, where you use the cartilage from the ear as an interposition between the joints if it's damaged, to allow some movement. So I remember we did these earlier with our plastic surgeon, Dr. B.K. Sharma, when we were working in the earlier hospital. So we did quite a few of these for the IP joints of the fingers or the thumb.
so that is interposition arthroplasty.
Yeah, but it's using the conchal cartilage, which is
that is interposition.
Yeah.
Recently, I have seen one patient who has shown.
Yes,
shown us this.
that may be he wants to see interposition arthroplasty. That may be the question.
There was another question on 5 differences or what?
So that is, if 5 differences is asked between 2 conditions, can we write more than 5 differences? For example, last time question asked, write 5 points with differentiate pyogenic, inflammatory, and osteoarthritis on the basis of synovial fluid.
Pyogenic is pyogenic and just a minute.
Inflammatory, sir, is the main point is
inflammatory and osteoarthritis on the basis of synovial fluid. Yes, there are 5 differences. Okay.
So, yes.
So 5 points. Yes, sometimes we asked, say, especially in the OSCE situation. In OSCE situation, it is asked. There is tell some 5 clauses or 5 differences or like this. So in that case, how do you write it? So this, first of all, see, there's the synovial fluid is asked. So there are synovial fluid as a physical character. You can ask first the physical character. From the physical, if you see the physical character, it is basically it's a straw shaped color. But if it is a pyogenic one, that leads to easily you can understand what would be it would be like a milk-like structure. If it is a rheumatoid or it is a tubercular, that will look like a water. That is one. So next one is the amount, and another is the viscosity. If it is not ideal, it's a normal viscosity of the synovial fluid. If you keep it, it will look like it will remain. It is very cozy, isn't it? So it is highly viscous. But if it is become infected or any inflammatory, that will loses the viscosity. So it will not stick. It will even stick inside with the container. Okay. Next is the hemorrhaging. If it is suppose it is any infective condition, that will lead to associated with some hemorrhaging as well. So this is a physical character. Now the amount of protein, inside. So especially among these all the conditions in the tubercular, it is a highly protein content. So if you keep it inside a test tube, it will remain settle down. That will make a cobweb coagulum. So this is better classically described in tubercular situation. Now the acidity, that the pH. So pH usually, what is the normal pH of the synovium? It is normally it is almost similar to blood. But if it is infected, then it is becomes much more acidic. So already 3 years come. Now the number of
Dr. Pal, his question was, if asked 5, can you write more than 5? So I think
definitely
would be that they probably have the marks allotted according to the points.
Yes, but if
you get to write a 6th one, you will get extra marks for that.
No, definitely not.
If I'm wrong, you might even get cut marks. So if you
exactly.
ask for 5, it's better to just write 5. Okay.
Better to just type 5. Yes.
So you have mentioned one more thing about piezoelectric current in orthopedics.
Yes.
So what is that, sir?
Piezoelectric current basically is used in it is for the ultrasound. It is ultrasound therapy, ultrasound for diagnostic therapy, as also for the therapeutic conditions. So for diagnostic, ultrasound is produced from the piezoelectric crystals. So from the piezoelectric crystals, these currents are produced. So now all of you know. So what is it? So basically, it is a physical structure, piezoelectric crystals, and it is used for this production of this current. Now it is specifically it is used for diagnostic purpose, also some therapeutic purpose. So with diagnostic purpose, maybe ultrasound guided some biopsies may be required. Some ultrasound, especially in the pediatric condition, for some specific diagnosis. Now therapeutic like this. So this is the way we have to write this.
So one.
Yeah, carry on.
Please, sir, if you would write that one.
No, it's carry on.
So one thing about that, there are few questions which is asked regarding metal. They have asked like metal hypersensitivity reaction, allergy, toxicity, or that. So when, or like biological response. So what a student need to write, and what are the differences between these, like hypersensitivity, allergy, toxicity? Is it same, or do we need to write something?
For the metal purpose, so basically that can produce 2 types of reaction. One is mechanical reaction, one is inflammatory reaction. So mechanical reaction is basically because of we remain a foreign body, some movements, micro motions, or that already told some previous plates are used on the basics, on the principles of the friction between the surface and the metal. So that can lead to some mechanical irritation, and that can lead to some inflammation, mechanical inflammation inside. And then that mechanical inflammation, that may be the basis of the loosening of the screws for the ordinary, the non-locking screws, and there is a sequential locking from proximal to distal. So that is the mechanical one, mechanical inflammation. Another is an inflammatory, is biological. So already there are some production of the metal debris, because the metal which is already inside the biological fluid. So that can lead to some liberation of the some debris, and this metal debris can lead to some production of there is inflammation by chemotaxis, and there are several, specifically the monocyte macrophage system, they have become activated, and that can produce a specific type of inflammation and if that inside any infective materials has come, that can produce some biofilm formation. So that is the way there is reaction. So in that sense, there are several metals. You can, like the stainless steel it is very much more incompatible in comparison to the titanium. And it says pure titanium. Again, there are two titanium and pure titanium and titanium alloy. But because basically the pure titanium is very elastic, and there is a possibility of deformation inside the body. So that is why the titanium alloy is used. So titanium along with some aluminum, vanadium, it is used. And so once it is introduced to the body, that reacts with the nascent the oxygen inside the system, that is a titanium oxide layer over the system. That acts as a passivation layer, which can prevent these from a formation of these inflammatory reactions. So in that way, the titanium is less immunogenic than the stainless steel. So in this way, there are several reactions can develop.
Okay, I think.
So, just one last question, sir. When we are like intraoperatively, do we are able to identify that metal reaction? Is it because of poly or because of metal? Like when we are taking implant out, sometimes we are getting some black color thing.
Yes, there is a liberation of the metal. So previously we have seen there's some black colored debris is coming inside the system. Basically, it is due to carbon contents of the metal. The carbon is added inside the metal for increasing its strength. That is increasing the stability and the strength of the metal. So that is why carbon was added. But now it has seen that if the metal is much more strong than the bone, that is elasticity is it is much more rigid than the bone. That causes the stress shielding. At the same time, that liberates this carbon particles inside the system, and that leads to several problems like that. So that is why it has become the metal has come with a low carbon 316 LV. The metal has come, which has a low carbon, but this specific technology added 316 the low carbon LV quality. That in spite of the low carbon, that increases that maintains the elasticity. And now there is the era has coming with the porous metal. That because of the porosity, the bone can grow inside the metal. That increases the osseointegration along with the metal. So that is the way how these recent advances are going on.
Okay, so I think one of the issues with all these new called biologics is that we still don't have very hard evidence on their sort of effectivity. So things like PRP, PRF, all these things there's a lot of research, there's a lot of papers out, but we still don't know how many of them are authentic or are these sort of related to medical companies pushing it, or because very few of them are actually recommended by national associations, etc.
Yes, I was checking that on AOS guideline for osteoarthritis, they have not included PRP.
Exactly. So very few of the national guidelines actually include them as something that is proven to be of benefit. So that's one of the problems. So these are recent developments. Whether they are truly advances or not, we'll only find out in the future.
Exactly.
So so you have to learn about them, but also be aware that they're not necessarily all very effective as yet, or have not been proved to be effective. Similarly, even BMP, there's a lot of, although you get many papers actually talking about how good they are for non-unions. You also have other situations where there's risk of teratogenicity and other things. So just be very careful about how you word your answers for these.
Exactly.
Okay, I think thank you very much, Dr. Pal, as usual. Very useful, and I'm sure the students will learn a lot from it and have learned a lot from it. So till next week to everybody, bye.
Thank you so much, sir. So next week we'll have John's distal radius fracture. We can plan some.
You sure I haven't done this before?
No, sir.
Okay.
Thank
Nice.
you. So much.
Okay, bye.
Again.
Thank you so much.
Bye.
Thank you so much. Sir. It was great, sir.